Hello, I'm Dr. Dashtban. In my practice as a medical psychologist, I've noticed that when a person experiences undesirable symptoms, for example pain, that there's often a distinction between what their physician calls a disease versus what the patient calls her illness. In other words, there is often a distinction made between disease and illness. Clinical experience has shown that people categorize their ideas about an illness around 5 themes. The first theme is identity. That is, how do you see yourself now that you have this illness? For example, do you say, I am hypertensive, meaning I have high blood pressure? Or do you say, I watch how much salt I take because my blood pressure seems to go too high when I take up too much salt? The second theme is cause. What do you think has caused your illness? Sometimes lifestyle choices do lead to some diseases. Sometimes a disease happens on its own. So what is your belief system about what caused your illness? The third theme or belief is timeline. How long do you think your illness will continue? For example, do you think it is going to last a long time? Is it going to last a week? Is this going to last for perhaps your whole life? So what is the belief system about timeline? The fourth theme is consequences. How much does your illness affect your life? For example, now that you have this disease, in what ways has your life been affected by it? The fifth theme is cure or control. How much do you think your treatments can help your illness? Or how much control do you feel you have over your illness? So once these 5 themes have been addressed, then you have a much better understanding of what your illness is, regardless of what the disease is all about. This means that you might have a much better chance of going about treating your illness in a far more effective way. In other words, you will have the chance to do what is called self-management. Self-management is the capacity of a patient to take appropriate responsibility for dealing with all aspects of their illness, including the symptoms, the treatments, physical and social consequences, and lifestyle changes. As a medical psychologist, my job is to help people self-manage their illness. For example, patients can learn how to monitor their condition and how to make whatever changes in their thought patterns, their behaviors, and their emotions so that they can notice a satisfactory quality of life.